I wanted to talk to you for a minute about restraints. I know you guys have all used restraints. Remember, however, that you want to be able to fit your fingers underneath. And of course, this should be also done as well. Remember that when you're tying the patient down, it needs to be to a part of the bed that does not move. It should not be tied down to the side rails. And you also want to do the one-handed release, so just knotting it and pulling it through so that you can just quickly undo that. A bow tie is not unacceptable. You can do that because it is still a one-handed release, so if that's more comfortable to you, you can use that method as well. It's super important that you chart on this every 2 hours within iCentra, and I will show you that charting here in a minute. And then as part of that charting, as you know, we're wanting to make sure the patient has all their needs met, and so just making sure that you've done those. So all our vented patients, for the most part, should be restrained, with the exception of the occasional patient that's completely lucid, able to respond to us, write us notes, that kind of thing. So your best judgment, but anybody for sure that's sedated and on a ventilator, they should definitely have restraints on. If they should accidentally wake up or become a little bit more awake, their first instinct is always go to that tube and try to pull it out. So please make sure you have restraints. So you should be pretty familiar with this charting. Make sure though you don't come into this first one and use the violent restraint charting, or you'll be doing it every 15 minutes. But you do want to chart here on the restraint non-violent, and you can see already the charting that they've done. All of our charting in these situations is done on the odd hour every 2 hours. So as far as restraints go on a patient that's prone, we've had to get a little creative in where we restrain their arm that's above their head and over the bed. But please remember, once again, to do that to a part of the bed that's not movable. However, you do not want to do it to the base of the bed in some fashion and then raise their head. You're going to pull on their arm. So once you get their head elevated in that reverse Trendelenburg position, then look for a place to restrain that arm that would be appropriate.